All righty. Well, thanks everybody for joining us this afternoon. It is now 12 and we're going to go ahead and start the session. Thanks so much for joining us today. My name is Lena and I'll be coordinating our final echo session for this series. This is session 10 and we will be together today from 12 to 1. So thanks for joining. I'm going to go ahead and have a look at the agenda and go over a few housekeeping items. We're going to try our best to adhere to this schedule. After I complete the housekeeping announcements, Dr. Olivier, who's our facilitator for the ECHO session, will lead us in introductions, and I'll tell you a little bit about PPCL. Then we'll have Dr. Queen present our didactic today on mandated reporting in pediatrics. Then we will move on to our case presentation presented by Dr. Natalie Tuchet. And then after Dr. Tuchet presents, we will open the floor for any clarifying questions, first from our participants and then from our hub team. And once all these questions have been answered, we'll transition to providing some recommendations. And after that, we will send out an email with all of the summary of today, and then we'll wrap up. All right. So Dr. Olivier, I'll pass it on to you.
Hey, good afternoon, everybody, and thank you for joining us again for our last session of this cohort. I'm Dr. Olivier. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana, and part of the hub team of experts. In each session for ECHO, we try to have a team of experts that represent different fields and aspects of mental health to help guide treatment and perspective on these cases. We have a couple of social workers on our team. Jody West, you'll see on the call, is in the background today, and also Lena, who already introduced herself. I'll ask Ashley Hutchins is our nurse practitioner on the team. You want to reintroduce yourself?
Hi, everybody. I'm Ashley Hutchins. I'm a psychiatric nurse practitioner, and I work at Bloom Mental Wellness in Lafayette, Louisiana.
Thanks, Ashley. And we also have a pediatrician on our team, Dr. Cocky.
Hey everybody, General Pediatrics in Broussard, Louisiana. Don't consider myself an expert, but I'll be on the hub team with you guys today.
All right. Thank you, Dr. Cocky. And I'm going to turn this over to Dr. Queen, who is going to present our didactic today. Dr. Queen, you want to go ahead and introduce yourself to everybody and take it away?
Sure. So my name is Dr. Katie Queen, and I am a general pediatrician at heart for 10 plus years, 12 years, I guess. But in my side gig, I do obesity medicine for the past couple of years for Our Lady of the Lake Children's Health. So I have a special interest in behavioral health, especially mental health, and I work in Bogalusa. So this topic is very relevant. I actually learned a lot by creating these slides. I probably wasn't doing my reporting exactly correct, so I'm excited to speak to you guys and teach you what I learned. Next slide. All right, I do have some disclosures, but they're not related to mandated reporting. I speak on 2 obesity pharmaceutical companies on their speakers bureaus, but it's not related to this talk. Next slide. Also, I have a disclosure that I'm not a lawyer, so if I tried to get the most evidence-based things I could find up to date, but just know that some of the laws I have on here, maybe they're outdated if they didn't update the website. So that's my other disclosure. I tried my best. All right, and that's just my sweet family. Actually, this picture cut off my 3rd child. I just realized that I have 3 daughters, and that's my husband. Next slide. Okay, so our objectives are we are going to talk a little bit about federal and Louisiana laws and sort of what you need to do, what happens if you don't do the mandated reporting. We're going to talk about what technically is considered abuse and or neglect. We're going to talk about the process in Louisiana for reporting. And then we're going to talk about just a couple quick cases in the 20 minutes, but the real case for this echo will come after my talk. Next slide. Okay, so federally, there is a law, I think it was like the 1970s that this was passed, called CAPTA, but this is really what sets all of the state laws for the minimum standards for what has to exist in a state around child abuse reporting. And so Louisiana has to follow the CAPTA, and then they can be more specific than the CAPTA law. And it also provides funding, which is nice to know that the federal government does support some of the funding around reporting and supporting the Child Services Department. And there are some definitions. So if you're really wanting to get technical, you can go to the federal website and learn more about CAPTA. But that's all I had to say about that. Next slide. So really what you need to know is the Louisiana mandated reporting laws. So this is all part of the Louisiana Children's Code 603. And if you're like me, you read these laws and it's sort of like way over my head. But if you go to the Louisiana Department of Child and Family Services website, they have a really good simplified brochures plus just kind of step by step what you need to know. So most of what I got for this presentation was from their website. And so I was interested to learn who exactly is included in this mandated reporting law. And these are who are listed out. So all health practitioners, obviously, physicians and PPAs, all social workers, counselors, so whether you're an LPC or an LCSW, it doesn't matter. If you're seeing patients for mental health, you're included. Dentists are included, which I didn't know. Nurses, MAs, basically anybody who's part of your medical team technically are mandated reporters. And I didn't know that because, sometimes the nurse will say, oh, well, I'm not a mandated reporter, so you have to report that, Dr. Queen. And I'm now learning, actually, no, anybody who knows about the potential abuse is technically a mandated reporter, including hospital staff. Residents and medical students are included, members of the clergy. So if you go and confess at Catholic Church, I guess you're part of it. Teachers, coaches, childcare providers, so Head Starts, daycares, things like that, and police officers. So this is what was listed on the website. Next slide. So there is another law that is within Louisiana that says your identity as a reporter, as a mandated reporter, is protected. So that's nice to know. In other words, if you are worried about retaliation from the patient's family, your identity is protected in your report, whether it's written, oral, or via the paper that you can fax in. So it is important to know that even though it does take your information, it is technically anonymous. Now, there's always that situation where I'm worried about, well, the family's going to know it was me because they just came into the doctor's office like yesterday. But technically, just know that you are protected as far as who it is. Next slide. And then this is another legislation that talks about what happens if you don't report something that was disclosed to you. So the fines can be anywhere from $500 to up to $3,000 if it involved something serious like sexual abuse or serious bodily injury, neurological impairment, or death to the child. That can be up to $3,000, but imprisonment can be anywhere from 6 months to 3 years. So I've never known anybody who that happened to, but just know that that is in our state statute, that you could be, put in jail. Next slide. So what are the definitions? What are the things that you need to think about with your patients or with your families that you're seeing? So abuse, I think, is pretty obvious to most of us. There's physical abuse, there's emotional abuse, which is a little bit gray. There's sexual abuse, exploitation, and trafficking. Under neglect, there's medical neglect, there's lack of supervision, and they list failure to provide basic needs, including food, clothing, shelter, treatment, so medical treatment. So failure to provide medical treatment is listed, and failure to provide counseling is listed. Now, I think that's a little bit gray, right? Because I have had many situations in clinic where I'm like, okay, I know this family has food insecurity and I know that they struggle to pay their rent. Does that mean we need to report that to DCSF? And so I don't have an answer to that, but I think that is a gray area. And they always say, when in doubt, make the report. But, there's that trust you have with your family and your patient. And so I think that you have to consider that as well. Prenatal neglect is technically included. So if you have a pregnant woman who is not going to prenatal visits, or you suspect she's maybe using substances, technically that can be reported to DCSF, or should be reported to DCSF. Caretaker substance use that's creating a danger. So if you know the family is potentially drinking too much alcohol or smoking pot or something worse, that's potentially putting the child at risk, even if it's just neglect, that technically is a mandated report. Next slide. So other kind of situations to report, you have to report if you have any reasonable suspicion. And I think the word reasonable is where I struggle sometimes. Like I had a kid just last week that the kid told me his mom or someone in the mom's home spanked him, but it wasn't with an object. There was no bruise on him. So I had like this red flag, but there was no really enough suspicion for me to make the report. But this is a kid that I'm going to be looking for other red flags. And if I have enough, evidence, I'm going to report it. But, spanking technically is not included in this unless they're using an object or they're leaving a mark. But obviously we want to have that conversation with the family about the inappropriateness of it. Thanks, Jody, for the smiley face. And then child disclosure, obviously. So even if we don't know if the child is lying, we should take it as serious, and we are mandated to report if the child tells us about an abuse or neglect. If there's some injury, obviously inconsistent with the explanation, if there's an unsafe home environment, or there's a pattern. And that's kind of what I was talking about. Like if this family that I had a red flag on has a pattern, and then I'm just going to go ahead and report it. But I just don't have enough right now reasonable suspicion to report that particular case. Next slide. So how do you report it? So if you are lucky enough to have a social worker in your clinic or in your organization, then they are very familiar with this, but we don't all have that. We used to have 3 social workers. Now we're down to, I think, 1.5. So now we're having to do that reporting. So the easiest way is probably just to go online, and this is a clickable link, but I'm not sure if they're going to get the slides or not, but there's a mandated reporter portal. If you go to the DCSF website, it's not right there. It's a little bit hard to find, but there definitely is a portal you can get into, and then you have to enter all this information. It's a little overwhelming if you've never done it. And I'm going to tell you on the next slide in a second what needs to be in it. And so it's more than you think. And you want to be as detailed as possible. Now, if it's an urgent sort of situation, you want to go ahead and call. So calling DCSF hotline, this is the phone number. It's open 24/7. And anytime there's a child fatality, life-threatening injury, drug-exposed newborn, that's not on sort of treatment. In other words, if I have a newborn born in Bogalusa that was born to heroin use, it's an immediate phone call. But if the mom was on Suboxone, then there is a different reporting form. Just want to point that out. So if the mom is on treatment, then it's not an urgent report. Human trafficking, safe haven laws, or sexual abuse or immediate danger. These things have to be or should be called in immediately. And then next slide, there is a rule that you're supposed to go follow up with the online report or this written report, which also is on their website, that can be then mailed into the centralized office. Unfortunately, I didn't see like an email, but I'm sure you probably could find some kind of fax or email. But that's supposed to be within 5 days. So if you have an urgent situation, you just make up the phone call. If you make a phone call, you got to make sure you follow up with a written report within 5 days. If it's not urgent, then you're going to go ahead and do the online portal. All right, next slide. So what do you need to document? Verbatim quotes are helpful so that you're not putting your own bias into the report. And so sometimes I've learned over the years to say, can you say that again? And I'll write down exactly what they said. You want to record physical findings and diagrams if needed. You want to include the date, the time, the zip code of where it happened is very important because I've had this situation where it happens in a different parish. And so then it had to involve the DCSF and the police of that parish. And the important thing is you don't need to go do the investigation yourself. If they report it, you don't need to say, well, let me call so-and-so and see if this is true and back up the story. You don't have to do that. That's DCSF's job. Okay, next slide. And there are going to be some HIPAA sensitive information in the report. And so just know that this is within HIPAA and it allows disclosure of the protected health information without consent. You don't have to ask consent for that. There is a minimum necessary rule that does not apply to mandated reporting. Honestly, I don't know what that means. I meant to look that up, so we're going to skip over that point. And you do have to document in the chart. You should document in the chart that you are providing this information. Maybe write the report number if you called. They usually give you a report number. Make sure you put that into your notes. Next slide. So this is something that actually ChatGPT made for me for this talk, but these are, so just in summary, these are the steps. So you have a reasonable suspicion. You are the mandated reporter, you make the phone call. But what I liked about this is showing that I think we assume that all reports are going to get they're going to get the family in trouble. They're going to take the child away. And what I've learned is that DCSF actually doesn't really want to take the child away from the family. They don't have enough foster parents, number one. But number two, they're there to try to protect the family unit. In fact, most judges nowadays are really trying to protect the family unit. And so what I think maybe people don't realize is behind the scenes, DCSF has an investigative team, and then they have a team that's more case, like once the investigation is over, that then takes on the family under family services. So during the investigation, it's a little touchy, right? And sometimes it means they're going to pry a little and they're going to come do a drop-in visit to the house. But if they don't find anything, they'll close the case. If they have inconclusive evidence, not enough evidence to take the child out of the home, then they will put them into what's called family services. And then family services will have the case open, let's say 6 months, where they're sort of there to support and check in on the family. And sometimes that means drug testing or intervention as warranted. And there's something in the chat that said, Sharon said the inability of a parent or caretaker to provide for a child due to inadequate financial resources. Yes, thank you. That was actually in there. Thank you for Sharon for saying that. You must work for I don't know if you work for DCSF or not. That was actually in there. If they don't have the financial ability, that doesn't require a report. Thank you for saying that. But I will say, like our social worker for a little while was reporting all of our patients with food insecurity, and I didn't like that. I sort of disagreed with that. But I will say that it did provide more resources to the family because they would just basically give them a bunch of resources for food and then they would close the case. But I do feel like that sort of messes with the trust between the family and I. Next slide. Now, some cases you have to report to both DCSF and to law enforcement. And so just take a look at the column on the right for law enforcement. So if you know there was some sort of homicide, rape, or child sexual abuse, you have to get the police involved. And so DCSF can help make the phone call, but if you have, the ability to, it's probably good to go ahead and make the phone call yourself so that it's not all this secondhand information. If there was a crime committed, such as maybe statutory rape or something like that, if there is a suspect abuse or neglect in a public or private location, or child on child sexual abuse. So basically any sexual abuse has to be reported to the police. Okay, next slide. Or abuse or neglect in public. Those are really the two big police times. So just real quick, there's some cases. So a father regularly yells at a young child. This is kind of like the spanking situation, but there's no marks. And there's no objects used. That might be something you're just going to monitor. You're not a mandated reporter to report that. But let's say that child has a mark, a belt mark, that is a mandated report. Let's say that a toddler presents with an unexplained injury. The classic is an infant that has a bruise on the face. It is important that you realize that infant isn't really probably rolling or crawling. So that is a mandatory report. Even if they say, oh, the other kid punched him or hurt him, you still really, I don't know, it's a tough situation, but when in doubt, report. And then if an infant is left alone at home, that's another example. So that would be more like the neglect. Next slide. There is a really cool mandated reporter training that is on their website. This is the QR code if you're interested. And so if you want to know more details, they probably have a lot more details than what I've given you today. One more slide, I think. Oh, and then just to let you know about the child advocacy nonprofit that exists in Louisiana called LACAC. And this is a organization that sort of is an umbrella for all of the child advocacy organizations, which are the places where these families can be referred to after the abuse for counseling, for that sort of recorded interviewing with the police, and sort of helping coordinate all the follow-up after your report. And so just know that, click the next slide if you don't mind. There is one in every parish. And so I'm just showing you the one that's in Bogalusa that we have dealt with a lot. And they're very helpful. So sometimes I'll call them, just ask them questions about things. And they get kids in for trauma counseling and therapy when my other mental health providers don't have any openings. Next slide. And then if you want to get involved more on a national scene, there is the Council on Child Abuse and Neglect, or SOCAN, that you can be a member of if you're a member of the AAP, and they have all sorts of free education in CME. Next slide. They have policies, and they have, just the AAP has all kinds of things on child abuse and neglect, but that's a great resource to go look at. And these were my references, and I think that was one more slide, and then that's the end. And this is my email if you have any questions. And then thank you to Sharon. Sharon, if you want to unmute, I'd love to know where you're from because you seem to be an expert in this. Maybe I should have had you give the talk.
I am not an expert. I'm a social worker at training grounds in New Orleans.
Okay, thank you. And
But I had struggled with that same question. So I had, I think you're right to struggle with that and maybe skip the step of reporting, but still get to the step of giving people the food resources for sure.
Mm-hmm. Yeah, and thank you for putting in there the elements of prenatal neglect report, which I think as a pediatrician, I don't really deal with that a lot. But, sometimes you may be taking care of a sibling, and then that the mom's pregnant and maybe not following up. So these are some good examples here. So that's the end of my talk. So thank you.
Thank you, Dr. Queen. We have a few minutes for questions. If anyone wants to unmute themselves or use the chat.